Hey everybody, welcome back to This Week in Global Health, which is otherwise known as TWiGH, which is a regular video series that discusses relevant and current topics in global health. In this episode, we are continuing our series featuring leading topics coming out of the latest publications in the Disease Control Priorities Network, and today we're going to focus on household air pollution. I'm Jessica Taff, and I'm hosting this show today from the Washington, D.C. metro area. And with me to discuss this important issue, we have two experts.
Ajay, Pillarisetti. I'm a postdoctoral researcher at UC Berkeley, and I co-authored a couple of the chapters in the environmental health or environmental in the environmental DCP3 volume. One, an overview of household air pollution, and the second, extended cost effectiveness analysis of household air pollution interventions in India.
Yes, and I'm Professor Kirk Smith at the School of Public Health at the University of California in Berkeley, and I've worked on household air pollution issues for nearly 40 years.
So I remember reading from this chapter that almost 3 billion people worldwide use solid cook fuels, despite over 100 years of the advent of cleaner fuels. So tell me, why is this important from a public health point of view?
Well, the burning of the solid fuels is basically either coal, which is largely used in China, or biomass, which is used all over the developing world. It's an issue of poverty. Poor people use these fuels. And the problem with them is that in spite of many people thinking that the burning of wood produces a smoke that is non-toxic, or actually there are a range of toxic materials in this smoke, and including particulate matter and carbon monoxide and various carcinogens. So it actually produces a very high exposure, and that means the amount of pollution that people breathe, because it's indoors often, and it's vulnerable populations of women and children that are exposed.
An exposure to PM in village homes can be orders of magnitude higher than in clean cities like San Francisco, New York, DC, Los Angeles. It can be even higher than concentrations in dirty cities like Beijing and Delhi. And so we're often seeing levels that are milligrams of air pollution per cubic meter. That's how we measure these things, a mass of pollutant per volume of air. Whereas in a clean city, you might see levels as high as 20 or 30 micrograms per cubic meter. So it's a huge range that you see in village households.
There's a lot of air pollution that's coming from households, hence why we're calling it household air pollution. And this is a major risk factor for health. So I also find that it's among the most important environmental health risk factors globally, and it causes 3 to 4 million premature deaths annually. What are the health and socioeconomic impacts of household air pollution? And what are some of the diseases that are linked to household air pollution?
So those estimates come from the IHME, the Institute for Health Metrics and Evaluation's Global Burden of Disease effort, and they link air pollution with 5 outcomes: lung cancer, chronic obstructive pulmonary disease, heart disease, and stroke in adults, and lower respiratory infection or pneumonia in children. And there's also a lot of evidence linking household air pollution with tuberculosis, low birth weight, and other pregnancy outcomes, and neurocognitive issues. And there's still research going on with those specific endpoints.
So these diseases are the same ones that are associated with other forms of air pollution exposure. Outdoor air pollution finds the same diseases, and even active smoking, sticking burning stuff in your mouth, which produces very high exposures to air pollution, also produces these. These are the main diseases caused by smoking. Of course, at much higher risk levels. Obviously, a smoker is getting huge doses of pollution and therefore has a higher risk, but it's the same set of diseases. And in fact, household air pollution is sort of in between these two other forms of pollution, the outdoor air pollution levels and the active smoking levels, and the risks are correspondingly in between as well.
In this chapter, and I think it specifically mentioned that you're defining and using the term household air pollution as opposed to the term indoor air pollution, which I think probably more people are familiar with and has been written about already. How are these things different in the way that you guys are talking about them in the chapter, and what are the implications of so-called dirty fuel beyond the kitchen?
So we transitioned from using the term indoor air pollution or indoor air quality for this specific issue to household air pollution because while the combustion starts indoors, it leaves the house. It leaves the house through the windows, through chimneys if there's one available, through openings, ends up outside. And in China and India, it's been estimated that between a quarter and a half of ambient air pollution, that is outdoor air pollution, comes from households. It originates from the combustion of solid fuels in households. So we think it's a big contributor to outdoor air pollution in addition to the exposure it causes indoors.
Yeah, basically another related reason is that calling it indoor air pollution sort of implies that just putting it outdoors would fix it. But we now understand that just putting it outdoors doesn't fix it. It comes in back in the bedroom, it goes to the neighbors, it goes down the street, and it eventually becomes part of outdoor air pollution. And so China, for example, is now embarking on a set of interventions to reduce the amount of household coal used and biomass used because of mainly a concern with outdoor pollution. So household was the best other term we could think of that represents the problem, but doesn't imply that it's all indoors.
Now, what countries actually have this largest burden of these diseases that are caused by household air pollution? And in these countries, what are they doing to address the problem?
Yeah, so the burden's largest in China, across South Asia and parts of sub-Saharan Africa, though obviously significant burdens exist in other parts of Africa, Latin America, kind of one-to-one relationship with poverty. Where you see a lot of poverty, you tend to see a lot of solid fuel use. And as Kirk mentioned, a few countries have had these successful transitions. So Ecuador has had their transition first from solid fuels to gas, and now from gas to induction-powered stoves using inexpensive hydropower. Indonesia completed a transition from kerosene to LPG. So kerosene, while a petroleum distillate, is a pretty nasty actor, releases a lot of chemicals that we think are harmful and looks to be associated with a number of bad health endpoints. So that was a positive shift. And then in China, there was a large National Institute Improved Stove Program. I think that's what it's called, but I'm not sure. Which installed hundreds of thousands of biomass chimney stoves in village households that were pretty transformative to the households. They raised the cooking surface off the floor. They had a large platform for people to cook and work on, and they were suited for Chinese cooking. So they allowed for high firepower for woks and that sort of thing. And those have been fairly successful. It's now moving to electric and gas cooking as well, because like we've mentioned, chimney stoves, while they might reduce indoor exposures a little bit, they tend to move the pollution outside, causing exposure outside or exposure back in the house as the air pollution comes back in.
Yeah, there have been other examples in the world. Brazil, for example, through policy, moved essentially everybody, 95% of their households to gas, to LPG. And there are other examples in Latin America and so on. But it's important to point out that it is associated with poverty. Basically, poor people use solid fuels, and no rich person uses solid fuels for cooking. And except once in a while in a barbecue, but all the poor people do.
I find this topic really interesting because I think it really comes down. You have to address it with typical public health interventions, and particularly it's going to be about addressing behavior change and changing habits, but it's also a development issue. So I'm wondering, do you think this is it really that simplistic, or is there really more to this?
It's a great question. One might think that over a long enough time frame, development will just take care of this issue. And if we look at the example of India, we can see that there have been about 700 million people using solid fuels for cooking now, and as there were 2-3 decades ago. So we've been kind of stuck. While the proportion of people using solid fuels has decreased, the absolute number has stayed constant. And that indicates that people are stuck in what Kirk and others have called the chula trap. Chula in this case being the Hindi word for a biomass cook stove, that there's this base population that just can't get out of using biomass in these simple stoves, regardless of all the development that's been going on in India.
So there are basically three ways to deal with this problem that have been addressed in the past. One is to sort of hope that development will take care of it, but that's been clear that this is not working. Actually, the number of people using solid fuels is about the same in India, has been for 30 or 40 years. The number in sub-Saharan Africa is going up. Every year there are more people using solid fuel. So waiting for development to occur has not solved the problem. Now, China, perhaps the levels of solid fuel use are going down, but they're going down slowly.
Well, I understand that there are programs that there are subsidies to encourage using clean energy like liquefied petroleum gas. But even when there are countries that have these subsidies, it's still not getting people. There's still so many people that are using the biomass fuel. For instance, in India, the 2011 census estimated that 85% of all rural households, which is about 142 million, depends entirely on the biomass fuel, which is like we talked about, the cow dung or wood for cooking. So why do you think that it's been challenging, even when there are these options like the subsidies, to promote using cleaner fuel?
Another great question. Moving people to clean cooking is pretty tough, so it requires changes in policy and behavior, and then importantly, steady supplies of clean fuel or electricity. So you can imagine that we hear cases where people have to commute maybe an hour, 2 hours in each direction with their heavy LPG cylinder to get it refilled, and they get there and maybe the shop's closed or they can't get their refill for some reason. And so there's a tremendous burden for people to go and deal with sort of the supply issue. And so, India's made a lot of progress in that regard, both through making supplies more accessible broadly and then through some innovative policy programs. And one of them that we think is the most innovative is called the Give It Up program. And it asks middle and upper class households to give up their subsidy, which is then retargeted one-to-one to poor households. And so far, around 11 million people have given up, or 11 million households have given up their subsidy, which is around a $1 billion so-called internal foreign aid program. So it's something that's directly happening, where you're seeing a transfer from wealthy and middle class families to poor families, and pretty rare for that kind of thing to happen, for a voluntary give up of a subsidy. And we think one of the reasons it works is because you're not giving the money back to the government, which not necessarily anyone wants to do, but you're instead giving the money to people in your country. You're helping improve the social welfare of the country.
The other intervention I know that's covered in the chapter are induction stoves. And I remember reading that this is actually, in the newer stuff that's coming out, can be more cost effective and cooking with this. So tell us a little more about this. I mean, how is this getting implemented, and what are the challenges regarding that in different places?
Induction stoves do look like probably the technology of the future. But you say India doesn't have a program of promoting induction stoves. They are picking up a bit in the normal market. You see them for sale everywhere in Delhi and in certain states of the country that have quite reliable electricity. For example, Kerala, induction stoves are coming in quite strongly just through natural forces, market forces. There are countries, though, Ecuador in particular, is a country that is changing out every stove in the country to induction stoves. And the reason for that is they already changed out to gas about 20 years ago, and they're now want to move from gas, which requires them to import the gas and to subsidize it, to use local electricity sources, local hydropower sources. So they call it green cooking. But in fact, I think it's part of the process the entire world is going through.
Well, with regard to the interventions, in the chapter you mentioned one way of implementing them would be through stacking or mixed use of these different interventions. Not, it's not one major intervention is going to fix the problem. But can you talk about how stacking or mixed use of these different interventions is actually challenging to do?
We think about stacking in a slightly different way. For us, we want to try to eliminate stacking as much as possible. For us, stacking means mixed use. And so you can give someone a clean stove, and if they don't use it or they continue to use their traditional stove, even occasionally, you're not going to see their exposures go down to the level we think is health protective. Not only do we need to encourage people to use the new clean stove or technology or fuel, but we also have to discourage them from using the old stove, and we need to reduce any barriers that might be there for the use of the new stove. So that's kind of how we think about stacking and mixed use.
It's not the problem with the new stove, it's the problem with the old stove. You have to have a way to get rid of the old, bad, unhealthy behavior. And what is the implication of that? One implication is that it's very hard to think of a business model. You can sell people things that are nice and they like, but then that might just sit on the shelf or only be used once a week. You actually have to get rid of the old one, and there's not very hard to think of a business model for that. But that's providing access to the fuel. And as we know, just providing access to things doesn't necessarily mean that people will use them. Of course, it's a necessary condition, but it's not sufficient. In the health field, we know just giving people access to condoms or access to bed nets or access to latrines or any number of other new health technologies doesn't necessarily mean that people use them instantly 100% of the time. You can't have usage without access, and the Indian government has found a way to provide access, but we still need to promote usage.
For a lot of positive progress to continue, there needs to be the right set of policy tools to incentivize households to transition to near exclusive use of clean fuels. And so that means doing whatever we can to ease the friction for the household for them to actually transition completely to clean cooking.
And I think that's really interesting. Like I said, I feel like this is such a topic that is a very classic public health issue, as opposed to some of the other diseases that have interventions that are really targeted towards the individual. This one really has to address the entire community. I found that fascinating, and I wouldn't even say fascinating, but just an important point that, you know, one person changing their behavior doesn't make a difference if the entire village is doing it, because that one person who changed their behavior can still be affected by the smoke from the other community members. And so I think it's interesting to put it in perspective with some of the other types of diseases or disorders that really, that even if one individual changes their behavior, it puts other people at risk. This is another really salient point I took from the chapter, was talking about how, you know, people's individual preferences. They don't like the taste of the food when it's not cooked with like a biomass fuel, or when it's cooked with the LPG or something. But the chapter had mentioned is like, yeah, but you know, we had the same issue with condoms, that people didn't like wearing them, or like you said, like the taste of cigarettes and things like that. And yet the health field really did push to change those norms. And I found that a nice example of that.
Yeah, we had a recent experience in Tamil Nadu where we were talking to a group of villagers about, you know, what some of the barriers were for them to adopt clean fuels. And, you know, the men were the problem, as is often the case. They were the loudest and most opinionated, though the women were pretty strong in this group. But the men were complaining about the taste and all that stuff. And the women basically said, well, that's not really a problem. And if you don't like it, don't eat. And it was pretty shocking to see. I mean, the women were on board 100% for a transition. They recognized the time savings associated with using a fuel as opposed to going out and gathering fuel. They recognize that taste isn't really that big of an issue, and they recognize the convenience that you can just, you know, turn the dial, light a match, and you've got a fire going to cook your food. And so that was a pretty revelatory little experience in the village.
So I think this is interesting, and it's something that the chapter also points out, is that women and children, but especially women, have high exposure to the household air pollution. I understand that access is an important part of addressing this, you know, this issue. Well, I mean, and access to interventions. But what about education? I don't remember reading a lot about this, and I'm wondering if the women are aware of the health risks associated with these stoves.
So there are a couple angles to that point. I think education is definitely important, but I think for a lot of the households, our research and others' research has found that the health angle isn't actually the most compelling to people to get them to change. So it might be that their walls are black, or their pots get ruined, or any other number of things that might drive them towards adopting a clean technology. Part of that might be that we haven't done a great job with the health messaging to date, and it's maybe not as catered to local conditions as it needs to be. And we've been working on that in Maharashtra a little bit. A second related issue is that we are seeing some of the health messaging get through in India as part of this big Give It Up campaign, where the messaging specifically targeted some health endpoints. I don't remember the exact taglines. Kirk, you want to?
Yeah, make a poor man's kitchen clean. was one of their major, it's and so clean and keep her from crying, with a picture of a woman cooking over. So they're not, they don't talk about COPD or lung cancer, but they're clearly, cleanliness and health angles. And one of them was, make a cleaner environment for them and a better environment for yourself. I mean, recognizing the outdoor air pollution. The biggest single factor for women, well, first of all, it's the aspirational. They see, LPG in the movies, and they see it on their rich neighbors have it. They know it's the right thing to be doing, or the modern thing to do. But the second thing is time savings. That's really concrete for the women. And it's not only time savings and not having to gather the biomass fuel. The whole process is easier. I mean, you turn on the stove, turn it off, don't have to clean your pots. It cooks everything faster. That's what, I mean, in these village meetings we had, that was clearly, the benefit that they saw. And that, actually is something we've been looking at and actually trying to quantify, the potential economic benefit of the time savings. And that's another chapter in this book we've been sort of talking around. Actually, we're able to derive a economic value for the time savings, using, I think, some pretty justifiable means.
Love to hear more about that. I definitely, I think, the justification for individuals to change their behavior, but also the economic justifications or economic influencers that get policymakers to implement these interventions is also really important. So what did you find with regard to that?
Sure. So what we did was we looked at some survey data run a few years ago that looked at how long people by state spent collecting fuel. So how much time they spent every day or every week going out to gather fuel for their cooking needs. And it varied widely, and I don't remember the exact numbers, but we were able to take that time spent and calculate how much time that means they collect fuel over a year, and then look at what their wage rate would be. So India has a program called the National Rural Employment Guarantee Act, and it guarantees people in rural areas a certain amount of employment per year at a certain wage rate, and that wage rate changes per state. So the nice thing about this metric is that we're actually able to assign a value to that time spent gathering fuel. So you're losing guaranteed economic inputs or wages. And what we found was that the combination of those wages and averted medical costs were pretty significant enough to make a variety of different interventions actually look pretty appealing to the households. And that ranged from chimney stoves to LPG and other intervention stoves. And part of the reason a chimney stove looks appealing is because the upfront cost is very low. The savings, both in terms of time and medical costs, were also much lower than if you were to transition to LPG, where your health benefits are potentially much greater and your time savings are much, much greater because you're gathering basically no fuel. And so we think those are pretty instructive findings. And we only looked in one state in India, and we're hoping to kind of expand that analysis to look at a number of different states where there's a lot of solid fuel use and a lot of fuel gathering behavior. But we think it indicates that programs that may look very expensive up front actually aren't that expensive. And another thing we found is that when we were doing some interviews recently, people haven't necessarily made that connection between their time savings and the wages they could earn. And so making that connection, you could kind of see light bulbs go off in the room when we did that. And we think that that's an important part of some future messaging.
I think it's a good place to end. And I think I enjoyed reading the chapter and learning about this. I wasn't as familiar with this topic, but you guys did a really good job of laying out the burden and all the challenges associated with really addressing the issue. And I think it's something that's not as familiar to people in Western countries, but it's important to bring up. So I'm glad we were able to talk about it today. So thank you for joining me and talking about it with us.
Well, thank you.
Yeah, thank you very much.
So let me also just thank our viewers for tuning in. And I just want to mention that we love to hear back from you, and let us know what you think about this issue by commenting on the video or tweeting at us. And we would encourage you to check out more of our videos on our webpage or by subscribing to our YouTube channel. And you can find out more about us at both places. You can also find us on LinkedIn, Twitter, Facebook, Instagram, and we have a blog. And if you prefer to listen rather than watch, we also have an audio podcast that is on iTunes. So again, thank you, Kirk and Ajay, for joining me today. And to our viewers, we'll see you next time.